New Zealand has a new drug in the fight against COVID-19. The antiviral treatment is used to treat mild to moderate cases in high-risk adults to help prevent more severe symptoms.
But a group of 150 doctors and scientists is calling for stronger measures like more mask wearing and ventilation, as our health correspondent Lucy Warhurst reports.
This is the first batch of the latest medicine to treat COVID-19.
In the clinical trials we did overseas, it reduced hospitalisation and death by 50%.
Molnupiravir, brand name Lagivrio, is an antiviral medicine which can be prescribed by doctors to treat adults at risk of progressing to severe COVID-19.
We need to have this in our back pocket ready to go for people who are infected and at greater risk, and in order to keep them at home and keep them away from hospital.
There are enough courses of Molnupiravir here to treat almost 30,000 people. You take 4 capsules in the morning and 4 in the evening for a total of 5 days. It's used to treat early COVID-19 infection and has to be taken within 5 days of symptoms starting. But 150 doctors and scientists say instead of relying on treating it, our goal should still be to avoid getting it. And they're calling for a stronger approach from the government.
There's waning immunity, both from vaccination and from infection, means that we're likely to have ongoing recurrent waves of infection if we don't put other measures in place to try and limit the spread.
There were another 9,000 cases today and 13 deaths, and as children head back to school on Monday, the risk rises.
Masking is really important. Masking in indoor public spaces where there's maybe poor ventilation. Masking in schools is part of that.
Masks in school are currently optional, but if it was down to the health minister...
I support the use of masks in schools. The reality is, for a lot of adults who get COVID, actually they get it from their children because they are big vectors of it.
While vaccines help prevent severe illness, immunologist Dr Anna Brooks says they don't protect against long COVID.
Studies that are coming out now are suggestive that it's only a minor protection, so that really means don't get infected. And even if you have been infected, don't think you're now bulletproof. You need to keep protecting because reinfections are happening.
And with winter on the way, the next wave's not far away. Lucy Warhurst, News Hub.